is the protect and enable agenda under the universal healthcare law, while the bottom 20% is the taking care of Filipinos agenda. So we focus on the top part, or the blue box. Did you know that less than half of the Filipino population actually have sufficient comprehensive health literacy? And our survey done in 2018 by the UP College of Public Health, it was shown that any Filipino who participated in this survey, only 40% can sufficiently access, understand, appraise, and apply the health information provided to them. And in fact, if you're even talking about excellent health literacy, that's just 8% of the population. That's why when we talk about transitioning to COVID-19 endemic state, we would want to slowly make the behavior, the healthy behavior, the easier choice wherever people are. That's in communities, in schools, and workplaces. We don't want to just simply rely on their individual knowledge and skills, because we already know this will fail them. As it fails, say, a lot of medical practitioners already know how bad smoking is, right? It's made up of thousands and thousands of carcinogenic toxins, but people still smoke. So in the same way, we don't want to rely simply on knowledge and attitude and skills of the individual, but we need to be able to shape the interpersonal community as well as the institutional level intervention. So our mission is to make healthy behaviors the easier choice for everyone, every time, everywhere. And in the DOH, we do have 7 priority areas which correspond to the 7 behaviors we want every Filipino to imbibe. And these are related to diet and exercise, environmental health, vaccine and immunization, substance use, mental health, sexual and reproductive health, and violence and injury prevention. And of course, for today, we are focusing on this environmental health piece, or our priority area 2. There are 5 action areas, meaning there are 5 interventions generally that we will be employing in order to make these priority areas, particularly UPA, to alive and keeping in the Philippines. These would include developing healthy public policies, creating supportive environments, developing personal skills of every individual, strengthening community action, and reorienting health services. Excuse me. So, in the second key action area, we talked about creating supportive environments, and this would include ensuring that places where we live, work, and study are conducive for health-promoting behavior. So, when we talk about healthy communities, the framework is what the DOH and the PHILWATER is about since 2022 issuance, and you can see here that out of the 12 criteria or characteristics for a healthy community, 9 are actually related to the blue box that we're talking about, the socio-economic and physical environment factors, while only 3 out of the 12 boxes correspond to the healthcare part. And if you look at the 9, 2 of them are related to what we're talking about now. So green and open public spaces, as well as clean and sustainable environments. So this is really the frame with which we want all LGUs to look at health beyond COVID-19. So when we talk about priority area 2, environmental health, we actually aim for every Filipino to practice, number 1, good personal hygiene and sanitation habits. 2, reduce waste generation and facilitate proper waste disposal. And 3rd, adequately prepare during the events, during disaster events. Studies have shown clearly that behaviors such as hand washing can reduce diarrhea by 30% and acute respiratory infections by up to 20%. We also know that good sanitation or having toilets can reduce diarrheal diseases as well as malnutrition or stunting. However, in the country, we still do have around 3.5% of households in the entire country. That's around 860 75,000 households out of the entire 25 million households in the country without a toilet facility. So imagine these families, even if we teach them to do hand washing, etc., basically because where they live at do not have a toilet facility, they are automatically already at risk. So poor hand hygiene, and poor sanitation contributes to transmission of diseases, including food and waterborne diseases. And this slide shows us the number of captured FWBI, food and waterborne illness events from 2017 to 2022. And so far, what we do know now is for 2022, we are actually have very, very high numbers of food and waterborne diseases. This would include diarrhea and cholera. So the peak was still also in 2017, but after that, you see the numbers really going down. But for this month, so year-to-year calculations, we are already way higher than the past 3 years. Then in terms of cholera, so this is diarrhea. So for cholera, we also know that we are now at almost 300% higher than our numbers in 2021. So, what are the interventions that we hope to keep doing? First is to develop, continue developing healthy public policies. Among those that have been issued in the past are establishment of local drinking water quality surveillance policy and the national policy on water safety plan. Soon enough, we will be putting out a policy along with several other government agencies on healthy public open spaces. We also do have provide DOH certificates for WSP or Water Safety Plan acceptance that's being done in the areas that you can see on screen. In terms of building supportive environments and increasing community action, the DOH has produced, alongside our partners, a playbook on behavioral nudges for hand hygiene. These are interventions that the local government unit can easily use in order to increase hand washing. So in each playbook like this, there is already a template ordinance that's available, tips on how to maintain hand washing facilities, how to encourage communities to invest in their public hand washing facilities, how to build capacity of local implementers, and there's also a lot of communication tools that are already templated and available inside the playbook. The playbook is downloadable here at the website that you can see on screen, www.happyphilippines.ph. We also do have some support for certain LGUs and households. So for next year, the DOH has proposed 76 million pesos in our 2023 budget to help build toilets for the 1,688 households. So it's still a drop in the bucket compared to the many that we need, 875,000 households who will need it, but because really it is the task of the local government unit to build this household, this 76 million is really just support to our LGUs, particularly the poorest ones who really will not have budget for building toilets. In terms of developing personal skills, we do have this partnership with USAID and PHAP on this happyphilippines.ph website, wherein you can access many of the materials that we have produced, and these materials can easily be downloadable and used. You can just change the logos, the messages are all vetted already. At the same time, we also celebrate World Environmental Health Day every September alongside our fellow government agencies and key stakeholders. So these are just some of the materials that we use. Our theme was Kapower. Overall, at the end of it all, we recognize that the pandemic has challenged our system, not just the health system, but the entire country, but we also do know that it has provided us a lot of headway in terms of, say for example, increasing the skills or improving the skills of the general population in terms of really just appreciating hand washing and sanitation much better than pre-pandemic, but also giving us headway as Health Promotion Office in the DOH to really get into or enter the spaces of the various sectors, because we said that the doors were suddenly open for us to help out rather than pre-pandemic. We were really trying harder to get into the agenda, to get help into agenda of the other sectors. Ngayon with COVID, it's a little bit more mainstream. They're asking for our help instead of us knocking endlessly on their doorsteps. We hope to continue to enable communities to change cultural mindsets and structural barriers, particularly say for sanitation. So there's still communities that would opt for open defecation to ensure policy support at the national but also at the local levels. And finally, of course, able to improve access, affordability, and acceptability of services, particularly when the population at risk are not able to adequately protect themselves, and so they will need health services afterwards. So with that, once again, we thank you all for this opportunity, and we hope we've illuminated some of the efforts that the DOH is working on alongside our different government agencies and partners towards being able to address and reach our Sustainable Development Goals commitment as it relates to water and sanitation. So maraming salamat po ulit for this opportunity. Thank you very much, and let's all work together towards a healthy community.
Thank you so much, Ms. Beverly, the one who read and delivered the message of our Officer in Charge, Dr. Vergeire of the Department of Health. So that's the situation for the Philippine.